Welcome to the internal cab of one of your Northwest Air Ambulance Charities helicopters. From here, our charity's highly trained clinical crew can quickly reach people in times of urgent need, provide treatment to stabilise patients at sometimes very difficult incident scenes, and transport them to specialist treatment centres across the Northwest in a matter of minutes. Our crew can be called out to a number of missions each day, with each one presenting a different challenge, so they need to be ready for a mission at any given moment when on shift. When the 999 call comes into the base, every single crew member has an important role to play. The coordinates of the incident location are taken, a route plotted, and the crew is assembled. A pilot plus paramedics, or sometimes a paramedic and doctor. Then it's helmets on and takeoff. This process takes just 4 to 5 minutes in total. Once in flight, our crew remain in close contact with the air desk at ambulance control room to receive updates on the patient's condition. From here, we can make a call on which hospital would be the most appropriate for the patient's injuries. The pilot will sit up front and fly the aircraft, while one paramedic takes the left-hand seat and helps to navigate. The second paramedic, or doctor, will sit behind and ensures that all destination options are considered whilst receiving vital updates from the air desk. On landing, our paramedics carry backpacks containing all the medical equipment to the patient, whether that means scaling a rocky hill, leaping a barbed wire fence, negotiating a muddy field, or running down the hard shoulder. The patient is assessed and any necessary treatment administered at the scene, before this is continued inside the helicopter on the way to hospital. Take a look around you. This small cab is where life-saving treatment takes place and vital decisions are made to transport our patients to specialist treatment centres across the entire region. The equipment you can see is incredibly important to ensure that our patients are given the best chance of survival. Look to the back of the aircraft. This large grey box is called a LifePack 15. It is a manual defibrillator which, with the help of a paramedic, can diagnose if you are having a heart attack and where in your coronary arteries it is taking place. It can also shock your heart to get it beating again, monitor the levels of oxygen and carbon dioxide in your blood, as well as lots more vital functions. Every ambulance and air ambulance is fitted with one of these machines. The large orange bag you can see to your right is a response pack. It carries the crew's standard gear and includes a suction unit, bone drills which can be used to inject patients with fluids and drugs, bandages, dressings, and straps to help reduce blood loss in cases of severe trauma. This bag will go to almost every single incident scene and is used as a first response to stabilise the patient. Because of the confined space in the cab, our crew deal with most injuries at the scene. The item just behind the response pack is called an Advanced Life Support Bag. In here is equipment to help our paramedics control the breathing of the patient if they can't do it themselves, for example, by inserting a tube into their windpipe. Above this and to the right is an orange machine, the Parapack ventilator. Once the tube has been inserted into the patient's windpipe, this machine will effectively take over and breathe on a regular cycle for them, blowing oxygenated air into their lungs at a certain pressure, depending on their size and needs. Our crew also carries oxygen. The glass vial tube with rising orange ball shows the oxygen flow rate. The yellow helmets you can see are for our crew when attending road traffic collisions. They include inbuilt visors and are worn to protect the head and eyes when treating victims who may be trapped inside vehicles. Moving to the front of the cab, the silver cabinet between the two front seats contains additional basics such as needles and syringes. Directly above this, in the black box, is our sophisticated radio equipment. This allows our crew to switch between talking to the air desk at ambulance control, as well as directly with other crew on the ground, who can provide important updates from the scene. Once the patient has been safely transferred and the helicopter flown back to base, our crew has an informal debrief and logs the mission in their records. The aircraft is then cleaned down, fuel levels are checked, and medical equipment is restocked, ready for our next mission.